Hey folks, unlike other videos you may have seen, this video is going to actually show you how to prep for this fun surgery and what to expect and before and after and all that kind of fun stuff. So let's roll. I had an anterior cervical discectomy infusion, level C5, C6, and for those of you who don't know what's going to happen to you is they're going to dig in from the front. Now I wore this brace because I'm supposed to be wearing it for 6 weeks, but I'm going to take it off in violation so that you can see that they actually go through the front. They go through the front and they end up moving your esophagus over and all that other fun stuff and to get to your vertebrae, and they'll actually put a brace on the front side, not the back side. Some people thought it was going to be on the back side of your vertebrae, but no, it's on the front side with screws and a little plate to fuse. And that plate there is actually, it's permanent for life, but it's actually temporary use because it's going to wait till all your bone and other stuff grows around it, which is going to take 6 months to a year. And then the plate's really not necessary anymore. But anyway, that's what it's for. So to prep, since I didn't know how to prep for this thing, and I had to discover everything, and I watched a whole bunch of YouTube videos just like you're doing now, and they really don't tell you. So anyway, here we go. 2 weeks before your surgery, you need to stop all vitamins, supplements, fish oils, ibuprofen, Aleve, aspirin, any kind of OTC prescription that you have not gotten cleared by your doctor. They don't want that. If you are on any antibiotics, they may postpone your surgery. The only thing you can take is Tylenol. So basically, don't take anything. This is what they want 2 weeks prior, okay? Because what's going to end up happening is after your surgery is that for 6 weeks you got to wear this hard brace. I know you've seen other YouTube videos where they say, yeah, we walked out day of and that kind of thing, and I only had a soft collar or no collar, blah blah blah. But I guess this is 2025, and the reality is they'll keep you. In my case, I guess, my case was not complicated, is they kept me overnight, and there's not going to be, you have to wear this brace for 6 weeks. I can't drive for 6 weeks because of that. You're not supposed to turn your head and stuff, and then I can't lift over 10 pounds for 6 weeks, and the big killer for me is I can't go to the gym for 4 months. That's wow, that's rough. Anyway. You're going to want to alert your boss that you're going to need to telework for 6 weeks, because again, you're not supposed to be driving if you have your kind of job allows you to telework. Shopping list, if you have a pen and paper, you'll need to write this junk down because you don't want to screw it and discover this stuff later, like basically I had to, but like for 6 weeks, you're not going to be able to go to the grocery store, right? Yeah, you can order food through Amazon, Uber Eats, and have food delivered from the grocery store and stuff like that. But I'm a pretty independent guy, and so I planned ahead. And I got basically 6 weeks worth of food, frozen and frozen fruit, and a whole bunch of other stuff, right? So you need to plan for 6 weeks of staying in your house. Also, you're going to want to get Tylenol, 500 milligrams. They don't tell you this until you're checking out of the hospital. Then you got to screw with all this, post-surgery when you're all messed up and you can't drive. So you got to be a burden to other people. So anyway, dudes, just get some Tylenol. It can be generic like this is, because you're going to take 1,000 milligrams every 6 hours for numerous days. And I wrote down, because I have a sheet and I'll show it to you in a minute, on how you track your medication, because you will need to, because the anesthesiologist, when they put you out, that's going to mess with your mind, your memory and everything for 5 days continuing after surgery. And plus, if you're on any opioids, which I'll talk about in a minute, that's going to also make your mind foggy. You'll need to write things down. But anyway, bottom line is that you don't need to get a huge bottle of Tylenol. I only use 42 tablets, so that will help you calculate how many you need. I used 42 500 milligram tablets, but you take 2 at a time, so it's 1,000 milligrams. So anyway, you only need 42 tablets, so you don't need to get a huge bottle from Costco, okay, or something like that. Other product you need to get, and I forgot to bring it down because that's how my memory is a little product over the counter called Senna spelled SENNA. They're 8.6 milligram tablets, and I couldn't find directions on there, but my surgeon told me how much to take. And what Senna is, it's a what is it, a laxative or stool softener, whatever you want to call it. And you'll have to take 2 tablets every 4 hours. And just for your record, so you know you don't need to get a huge bottle of it, I only ended up taking a total of about 20 pills, 8.6 milligrams. That's right, 8.6 milligrams. Okay. Anyway, you end up taking 2 tablets every 4 hours roughly, and you do need that because of all the drugs they give you in the hospital and things like that, and also the opioids they're going to give you, and you take home. It will make your stool bricks inside of you, okay? And unless you like passing bricks, you're going to want to get this product, right? So get that ahead of time also. And again, I'm only going to need 20 tablets, and I think my bottle has like 100 in it or whatever. Anyway, you also want to get, and I have trouble saying it, Hibisclean's Antiseptic Cleans Skin Cleaner. It's surgical soap. Okay, and you can find this on Amazon, and I'm sure I got mine on Amazon, but you can get yours at Walgreens, things like that. But you don't need to get a ginormous bottle because you're only going to use it twice, one the night before surgery and then the morning of surgery. And so this is only a 4-ounce bottle, and that's all I use of the whole product. And so anyway, you don't need to get a big bottle, but you'll need to have that. Also, you need to get apple juice. They want you to drink 4 8-ounce cans of relatively clear. I couldn't find totally clear, but clear, either Mott's or Treetop. They recommended those 2 brands. I don't know why. I don't care why. But anyway, Mott's or Treetop. You want to get a total of 4 8-ounce cans because you'll drink 2 8-ounce cans the night before, and then in the morning you're going to drink 2 more 8-ounce cans the day of your surgery. Okay, and again, you're supposed to get as clear as possible. And I did notice when I was at the grocery store in advance that Mott's or Treetops, whatever brand I got, they had like a darker color one and then a lighter color one. And so I got the lighter color one. The other option, my surgeon said, is you can get a clear Gatorade. So you can get clear Gatorade if you want. Anyway, if you don't like apple juice. You will have to get, like I said, the cervical brace, and this is a scam in progress because if you go on Amazon and you Google Aspen, that's the name of the brand, Aspen Vista surgical brace, they're only $50. But for some reason, the week right before my surgery or of my surgery, I had this Aspen rep reach out to me directly and said my surgeon had referred this and she's going to have this at the hospital for me and all this kind of stuff. It's all very shady, very middleman kind of thing. And I had Kaiser. I don't know why they just didn't have this in the hospital. Something's going on here, middleman. Anyway, it's only $50 on Amazon, but I'm sure I paid $300 to $500 for it because they brought it to the hospital and all this kind of garbage. I don't get it. And it only comes in one size. It's not like it's a custom thing anyway. But anyway, you're going to have to get one of those. Whether or not you get it through Amazon, but most likely your surgeon or your hospital is going to provide it via this middleman snake kind of thing going on. I don't know. And you can also order replacement parts. And you're going to want to do this because you're wearing this fun thing for 6 weeks and it's going to get dirty, especially right out of surgery. Like when I got out of surgery, they had all this orange junk, antiseptic, I guess, or whatever, all over me. They didn't do a very good job cleaning up. And so when these pads that are on this brace are touching you, that kind of thing, it's white, this is the side that touches you, you'll see all this orange crap all over this. Anyway, you're going to want to wash these, and so you can't be without your brace. You need to order some, what is this called? Aspen Vista replacements, and I just did it on Amazon, and it was $15 for these little replacement pads, and so you can wear your brace while these other ones are drying, and then rotate them out and that kind of thing. So anyway, that's on your shopping list. Is you can either do it now or later, but at some point you need to go on Amazon and get those $15 replacements. Other videos you may have seen said that you could not shower without having some waterproof bandages, and these are allegedly the best on the market to get. I've had other people tell me they've had other brands that don't work well, but this brand works well, reportedly. But you don't need them. guess these days, the story, and I bought them in advance, but they put this Dermabond. And the reason I'm shirtless is so that you can see what they did to me. Those cruel people, is here's where they made the incision right here, and they put Dermabond. It's basically a glue over it. They don't use strips or band-aids anymore. And I wanted to show y'all this. I don't know what this is about, why this is bruised down here, and it used to be actually longer, going up like this. It may have been because, I don't know if you can still see it. I can't see from the camera. There's a little hole in me also. That's where they put a drain. They put this little bulb and a drain in you post-surgery, so that it's like sucking out the excess blood or whatever from there, and they'll take that out in the hospital right before you leave, but you're gonna have another little hole somewhere. I don't know where my holes are, but anyway, there's a little baby hole. It's already healed, and I'm about a little over a week out of surgery, and so it's already healed. But anyway, they're gonna put this Dermabond glue or whatever on you, and the doctor said 2 days after surgery I can shower. Just don't touch it or scrub it or put soap on it, but I can shower my head and just let it fall over it and that kind of stuff, and you're fine. So anyway, I didn't need those bandages, but now I'll have them for life. Also, they're going to tell you that they're going to give you literally, well, for Kaiser did, 12 pages of instructions to read for pre-surgery and post-surgery stuff. There was 12 pages. I ended up narrowing it down to 6, cutting out all the BS and the repetitive stuff. And anyway, there's about 6 pages worth of reading to do, but you're going to get 12. But with that, the reason I'm mentioning that is they say, yeah, bring overnight clothes, because some of our patients, which I'm hearing all of Kaiser's patients, have to stay overnight, okay? But it says bring pajamas. Don't bring pajamas. You're going to be in a gown the entire time. You're wasting your stuff. In fact, the only stuff you need to bring is the stuff on your back, okay? Where the clothes that you're going to be coming in with, and then you're going to put those back on when you leave. That's the only thing you need to bring, okay? I don't know if you notice every time I swallow, because again, they said that my surgeon said, again, because you're so muscular, it was hard for us to move your esophagus over and whatever. I never even worked my neck, so I don't know what they're talking about. But anyway, so sometimes when I swallow, it's a little harder for me to swallow, but it's fine. It's not going to be an issue, that kind of thing. But anyway, the other thing about don't bring pajamas, you don't need pajamas, all right? You're going to be in the gown the whole time. But if you have a CPAP machine, you're supposed to bring that, or a CPAP-related mouthpiece, where it's not connected to the machine itself. It just prevents you from snoring or whatever. You'll need to bring that also, because again, you're going to be staying overnight. And any medications you may normally take or need to take for an overnight stay and in the morning, okay? Just check with your doctor. I'm going to mention Uber, Lyft, whatever you want to call it. The rideshare program is, my surgery was at 7:30 in the morning, and I had to be at the hospital at 5:30. And I didn't want to bother any of my friends or anything like that that had to take me to the hospital. You just drop me off, that kind of thing. There's no need for anyone to go with you. And so I just took an Uber, and it proved to be true. I just took an Uber, it was whatever, $6. I was there, and they're going to take you upstairs, and you check in, and you're going to go immediately into your room. You don't need anybody with you, okay? It's just a hassle for them, and they're trying to think of that. And same thing with coming home. I did have somebody pick me up, because that's a normal procedure. Who's going to pick you up? Who's going to pick you up? You don't need anybody to pick you up, because when you're walking out of that hospital, you're not walking. They roll you out for insurance purposes, but once you get to the outside of the hospital, you can do whatever you want. You're fine. You can walk. You can function for this type of surgery and do whatever you want. If I had to do it over again, I would have just called an Uber to pick me up. Not burden somebody else to come to the hospital. Take their time. Whatever. I know a lot of people and people did volunteer to do it, but just take an Uber. It's fine. They also want the before surgery for you to have good nutrition, and which may be a struggle for some. But anyway, you want to eat high protein foods like beans, lean meats, fish, eggs, things like that, and high fiber whole grains, fruits and vegetables, all the stuff that you usually don't eat. That's what you need to eat. They will do blood work about 2 weeks prior to surgery. They will also do an X-ray, another X-ray. if you were predicted to have needed to have surgery like 6 months ago and you had X-rays and MRIs and things like that done, you'll have to have them again right before surgery. They usually want you to have X-rays or MRIs done within the 2-month window of surgery, not 6 months. So anyway, not back to me, of course, which was more money. And so I had to have X-rays and MRIs done about 2 weeks before, and they also did an EKG. My primary care doctor did, because they'll want you to go into for a visit about 2 weeks prior with your regular doctor or someone similar, just to do regular type blood work, the EKG, and again, if you haven't had your X-ray or MRI done within that 2-month window, you'll have to have it again. All right. So now, the night before surgery, what's going to happen is you need to stop eating or drinking anything before after 10 o'clock p.m. Okay. Again, my surgery was at 7:30. You can't drink anything after 10 p.m. or eat anything, right? And that's where you also get to take the little fun high bliss cleans, whatever this is called, shower. You don't put this in your scalp or your hair or eyes, nose, mouth, genitals, things like that. It's just for your body. I'm gonna cough. Sorry. It's just for your body, and just shower with it, lather it up, that kind of thing. And then you're gonna do the same thing in the morning with the same product, okay? You can before you use this, you can wash your hair with shampoo, your regular shampoo, but then only use this. Don't use any other regular soap once you use this product on your body, all right? Before you go to bed, like I mentioned earlier, you do need to drink those two of the 8-ounce cans of apple juice or Gatorade, whatever you want, okay? Now, the day of surgery, there's no food you can't eat, which is rough for me, but you do need to, again, drink two more cans of the 8 ounces of apple juice. No meds unless cleared by your doctor, but you can take them with you, or ask your doctor if you can take your whatever you may be on, okay? And again, you're going to take your little fun shower again, and after your shower, no lotions, no deodorants, makeup, perfume. They want a clean, pure human being laying on there. You're just a piece of meat, and they want you clean, okay? So none of that. And again, like I said, I took an Uber there. It was fine. And they're going to make you strip. Like I said, you're going to go upstairs, and then they're going to make you strip. You put all your junk into a little bag, and that bag travels with you wherever, but don't bring any jewelry or that kind of garbage. They want just a human body, okay? Anyway, you're gonna put on your gown, and you're gonna wear that the entire time, so you can wear the same clothes you brought in, okay? You don't need to bring books. They also said in that 12 pages of garbage, bring the books, bring headphones. You don't need any of that stuff, because when you wake up, you're gonna be out, then you're gonna believe you don't need any of that stuff, okay? And there's a TV in the room, okay? When you're in that room, I'm gonna cough again. Sorry, folks. They're gonna once you're in that little pre-op room where you change into your gown, you're laying there, there's going to be a nurse that's going to come in and take all your vitals and garbage, things like that. But they're also going to then put an IV in, and they don't put it in your elbow right there. They put it in your hand, or right there, your wrist basically is where they put an IV in. And they're going to start pumping antibiotics into you. And so they're going to do that. And then they will eventually, right before you get rolled into surgery, they're going to then start pumping a sedation in. And but before they do that, you should tell your nurse, before you pump sedation in, let me know, so you can go to the bathroom like right before surgery, just so that you're totally cleared out, that kind of thing. Because you'll wish you had if you didn't. I did. I thought I had. Because you don't want to wake up then have to immediately go to the bathroom, that kind of thing, all right? But anyway, they'll start pumping in sedation into you, and then they'll start rolling you in. For me, when they were rolling me down the hallway toward the operating room, that sedation's pretty strong. I was out. I don't remember even going into the operating room or any of that stuff, much less them getting me off the bed, onto the surgery table. And I know they do that because they bruised me on my bicep, but so they were manhandling me. Anyway, doctor, before they roll you down that hall toward the room, that your surgeon's going to come in again and give you, the spiel and make sure he remembers who you are, and that kind of thing, and what's going to be happening. And also the anesthesiologist will come in again and ask you a whole bunch of questions. They're responsible for not only for knocking you out, but also your breathing and that kind of thing. And then a third person will come in. I believe it was I believe they were called a physician's assistant. I don't know. There's a party going on in there, but a PA, physician's assistant, will come in, and she's responsible during surgery she's going to stick you or poke you with needles or pins or whatever, and including on my forehead and things like that, and your feet. You'll wake up if you notice even those little prick marks on you and that kind of thing, because they are screwing around with your vertebrae, which is right there by your spinal cord, and they want to make sure that they didn't damage any nerves, blah blah blah. And so they're testing responses and things like that. All right. So anyway, that's coming your way. After surgery, you're going to wake up in the hospital room, not in a recovery room. I remember when I had my tonsils out years and years and years ago, you wake up in this big old room with lots of people, and I woke up at my room. And the surgery is about 3 to 4 hours. Mine was 4 hours because, again, they allegedly had a problem moving over my esophagus and things. Maybe that's because that's why my scar is a little bigger than the ones that I've seen on other YouTube videos and things. But, and I forgot to mention, I told you they put this Dermabond stuff on there. They don't want you putting any other bandages, creams, lotion, nothing. Okay, so it's just let the Dermabond stay until it withers away, or dissolves or whatever, right? Which is allegedly going to be within the 6 weeks time period. But anyway, so you don't put anything on it. Anyway, you're going to wake up in the hospital room, and it's about 3 to 4 hours worth of surgery. You're also going to find that they have these pressure sleeves on your calves, on each of your calves, and they're the long sleeves that with Velcro on them that blow up, then they let out, and then this other one. Well, that will happen your entire stay while you're there, which really makes it hard to sleep. Well, for me, I'm a light sleeper, but they don't want any blood clots forming, and so these things just go back and forth, like that, really, not like that. Go back and forth so that you don't get any blood clots and that kind of thing. All right. I was able, when I woke up. Again, my surgery was 3 to 4 hours. I went in at 7:30. I woke up probably around, 1 or 2, something like that, in there. And my throat really wasn't sore. It still isn't sore, but like when I swallow, sometimes it is not really sore. It's just, come on, everything get back in line, basically, kind of thing, But it's I didn't have a sore throat, and I ate dinner that night in the hospital, and I ate everything, and it didn't slow me down a bit. Okay, let's see. You're going to stay the night, and they're going to take vitals every 4 hours, at least Kaiser did. And I went to St. Joseph's Hospital here in Denver, which has a relationship with Kaiser, and they were awesome as far as the hospital and all the technology and things they have available. It was a good space. I would recommend it. But anyway, the nurse does come in every 4 hours to take vitals, your temperature and pulse, and everything's fine. And they're also the ones that are pumping you full of the opioids. Okay. So opioids are things like Oxycontin or Dilaudid, it's Dilaudid, and I ended up getting Dilaudid because it's like one step up from Oxycontin, because I had a problem with my leg, knee, or whatever, my knee, and they gave me Oxycontin, and that didn't seem to do anything for me. And so anyway, the surgeon said, okay, give him Dilaudid. It was like, A or B, it doesn't matter. Okay, they're both the same, but this, I guess, has a better kick. Anyway, that's an opioid, and they gave me that. First, they gave it to me injection wise, and they gave me a lot for I don't know how much, but that put me out. I slept most of the afternoon just because they gave me that. But anyway, but one other thing you're going to want to get. Did I put that on the shopping list up above? I did not. So you need to add this to your shopping list if you don't have this, okay? You're going to want to get some earplugs, okay? Some little foam earplugs, okay? If you don't, you're going to wish you had, because the hospital environment is very loud. And again, I'm a light sleeper, but anytime the technology they have these days is that along the hallway, because you're not the only one there, right? Along the hallway, anytime somebody gets out of bed, it sends an audible alarm to the nurse's station, and it is loud, okay? And so all night that alarm's going off. I had earplugs in, and it was waking me up throughout the night. People getting out of bed and wah, 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 wah. And so and the same thing's going to happen with you when you get out of bed, even when the nurse is in there, and you get out of bed to go to the restroom because they don't want you to get out of bed without the nurse present. But anyway, you're going to hear the alarm sound out there, and they have to turn it off right there at the bed and that kind of thing, whatever. But anyway, it's really hard to sleep, and then you'll hear nurses laughing and talking and stuff like that out in the hallway, people screaming. No, people weren't screaming, but you're going to want to have earplugs, all right? So plan ahead, get these little puppies, and then when you wake up like around 1 or 2, you know, in the afternoon after your surgery, just plot them in so that when you do sleep, you can try to get some quality sleep with all those pressure things on your calves going like that, and then it's people talking and bells going off everywhere. You're going to want earplugs, right? When I woke up the next morning, I had my morning breakfast and I ate like a pig, and no problem. And you're going to have your post-op visit from your surgeon will come in just to see how things went, and right before they roll you out of surgery, in the operating room, they actually take x-rays again to make sure that the plate and the screws are seated well. And the doctor reviewed those with me, saying this is what you look like inside now, a freak. Everything was fine, all right? But anyway, he discussed everything. But later on that day, you know, like in the afternoon, they are going to take x-rays again to make sure it's still seated well, okay? Now, I already mentioned I have to wear my hard brace for 6 weeks. Can't lift anything over 10 pounds for 6 weeks. Can't drive, no gym for 4 months. And I'd recommend while the surgeon is in there, because I had a little bit of trouble getting this done post, is while the surgeon is in there that you ask for your work release note that you can only, you know, work remotely for 6 weeks, because in my case, even while I was at the hospital after the surgeon had already left, I asked the attending nurse, and she got into the system, and they gave her the runaround. Then when I got home, I had to screw with stuff. You know, it's just a mess because it has to come from the surgeon, apparently. Can't come from the provider or anything like that. Anyway, so ask for them right then and there for that so that it'll get done, because you'll need that. When you return home, you're going to have a call from a nurse in about, I haven't had mine yet. Like I said, I'm just past a week after surgery. But about a week and a half after surgery, the nurse is going to call. You'll have a phone visit, all right? You're not going to see your surgeon again for 6 weeks after surgery. That's where he'll evaluate if you get to take off this party collar. And then, but keep in mind, like a day before or 2 days before, you do need to have x-rays done again. They will have already ordered them, just don't forget, because they want to make sure during this 6 weeks before, when you're seeing your surgeon, that everything is still seated well. I keep on pointing back here. Remember, the plates are not back on the back of your vertebrae. They're on the front, like right below your esophagus. That's where the screws are and the plate. Anyway, so no OTC medicines or anti-inflammatory meds until cleared by your doctor, which is going to be 6 weeks. I have been taking the Dilaudid, like I said. I'm not taking Oxycontin, but I am taking an opioid, or was taking an opioid called Dilaudid. And here's what I recommend. If you're going to write something else down, you should write this down, because this is important, okay, is that like I said earlier, when you get out of the hospital and you're on these opioids and things like that, your mind is going to be foggy. Your memory's not going to be as good as it maybe previously was. And so I found this to be a method, is that I wrote down in columns every drug that I'm taking. So the Dilaudid, the Tylenol, and the Senna, you know, which is the stool softener thing. And then I would put the date that I took it and then the time. I'm telling you guys, if you don't write down the time, you will forget. Anyway, I wrote down the time, then parentheses, how many pills I actually took. You will forget, okay? You just can't help it. So anyway, and I just wrote it down so I know how much I was taking. So I ended up just taking the Dilaudid here for 3 days post-surgery. I took the Tylenol for 8 days. And then I took the Senna for 7 days, okay? Now, one thing about Senna, and you better listen carefully on this, you're going to want to start taking that immediately when you get home, okay? You're supposed to take 2 pills in the morning and 2 pills at night at bedtime, all right? But you're going to absolutely want to take that. You don't want to have a bad bowel movement. You'll be very, 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 very sorry, okay? You're also supposed to drink lots of water. I'm bad at that. Just as a norm, I always try to, because I just don't like drinking water. You know, but I got Propel that has flavored water in it, and it's good for you. It has electrolytes and whatever. Anyway, I drink that. It helps me. All right. The Dermabond, like I said, there's no maintenance to it. There's no Band-Aids. Don't put anything on it. The surgeon told me, if around the area, if it starts to swell or anything like that, that I'm supposed to let him know. But a little bit of swelling is okay. But if there's a big bubble of swelling going on, then yeah, you need to let them know. That means basically it's infected underneath there, or they left something in there, and you'll need to call them, and they'll probably just give you antibiotics or whatever. But I'm not on antibiotics post-surgery or anything like that. Okay. I also said earlier, and that's still true, that you can shower 2 days after surgery. Again, just don't scrub this area. Just you can shower, do everything normal, and it's like you're fine. The cervical brace, I've already discussed that, and how you will have wanted to order replacement pads so that you can clean one. And the way I found that was good is that since there's so much like oils and from your body and that orange junk or things like that, is and they say in mild soap, like they don't tell you what mild soap is. So anyway, I just got a small like pan, and I put these things in there with the white facing down, because that's the side that touches your body, facing down in warm water, and I put some Dawn, a little bit of Dawn in there, not a lot, and I let them soak there for probably about 5 hours, and then I got them out, and with that same soap that's already there, just kind of, anyway, it made them clean. So there you go. You're supposed to walk at least 30 minutes a day after surgery for 6 weeks minimum, okay? And I should say a minimum of 30 minutes a day. And that can add up if you're just walking around your house. So if you only walk, from here to there, and that takes 2 minutes, okay, that's fine. Well, then you walk again later, another 2 minutes, so collectively it's 30 minutes, okay? I actually go outside and I walk, 30 minutes. And I do it several times a day. I have a dog, so it's working out well. But you're supposed to do that to avoid blood clots and that kind of thing. And in the hospital, when you're actually, I forgot to say, when you're in the hospital, they're so worried about the blood clots. That's why you have the things on your calves that are keeping you up all night and that kind of thing, along with all the bells and whistles going off. But they'll also give you, after surgery, in the recovery room there, a little shot in your abdomen for preventing blood clots, whatever, okay? You do have to sleep with this thing on. Like, the only time the doctor says for me to take this off is 2 times. One, showering and eating. Those are the only times that you take this fun thing off. And of course, making this video. But showering and eating. And for those of you who like sleep on your side or stomach, well, you can forget that, okay, because that's not going to happen. But one thing I would recommend, and I've actually been on this product for years because my mind races anyway at night, and it's hard for me to sleep. And so I've been on a product called, it's a drug. You have to have it prescribed by your doctor, but it's not a hardcore drug. It's called triazidone. And triazidone, basically, you take that 30 minutes before you want to go to sleep, and it's not going to knock you out or anything. It's not, again, nothing hardcore, okay? And but when you close your eyes and you just kind of leave it play, it just kind of helps you fall to sleep, okay? But if the phone rings or something like that, you're still going to wake up, okay? It's not that kind of thing. It just kind of helps you go over that cliff, okay, to go to sleep. And triazidone is actually an antidepressant, but the maintenance dose for triazidone is 300 milligrams for it to be working, that kind of thing. As an antidepressant, anything lower than 300 milligrams, it acts as a sedative, roughly, okay? I'm taking 50 milligrams, and I've been taking that for well over 10 years. Works well. So anybody, the reason I mention that is that if you're not, no one is accustomed to sleeping with this little hard thing on, but you may want to ask your doctor to prescribe 50 milligrams of triazidone for you to help drift off to sleep every night, and then you'll become addicted to it. And no, it's not addictive, but anyway. The last thing I was going to show you is how to put this fun thing on, is because they don't tell you that too. You just wake up with it on, all right? It's Velcro, it's cool, and these pads come off via Velcro, so it's cool. But anyway, you just got to rip off one side, and you come around, and you put this thing on, and then you just tighten back up this side. This thing goes on the inside, and you just tighten it back up. This little knob here you pull out, and this adjusts the up and down of the chin dill. I'm supposed to have it kind of snug, to keep your stuff going. So how do I look? I look great, right? Yeah. Anyway, 6 weeks, man. Cool. All right. Hope that answered a lot of questions for you, and speedy recovery.